So, welcome everybody to my presentation about the bubonic plague. Let's get started. So what it is. The plague is a virus, and the bacteria this virus is formed by is the Yersinia pestis. This virus is transmitted through the bite of a flea. You have at the bottom the MLAs, and there you have an image towards the right of a flea and of the bacteria, the Yersinia pestis. Sorry about that. So, who discovered it? The famous man who discovered this is Alexander Yersin. He was born in 1863 and died in 1943. He was a French and Swiss psychician. You have at the bottom the MLA, and to the right an image an image of the man. Symptoms. So you have fever, headache, chills, weakness, one or more swollen, painful lymph node, which are called buboes. To the right, again, to the image of the man, you see also you can get vomiting and quite a few other things. So how to protect yourself? You should stay away from dead or infected animals because they can pass you the virus. You should also fill up holes in your house to prevent small animals from getting in, that being rats, mice, squirrels, or anything. You should also clean your yard so that you don't attract any animals and therefore increase the chances of getting infected. Let's continue. So, prognosis for a patient. Before in the mid 1300s, I would tell an infected patient to say goodbye. This is because if the patient has already been infected for 3 days, they have an 80% chance of dying. Before there weren't any antibiotics. Now I would tell the patient they have a higher chance of surviving than of dying. Now there is antibiotics nowadays, and that removes this high chance of dying. So now there's a very slim chance that you don't survive. You have at the bottom the MLA and 2 images. History. Okay, so the plague originated in China in the year 1300. This plague killed more than 25 million people worldwide. All of this in roughly 10 years. You can see in the map how the plague was transmitted. Boats would leave from one place, carry rats with them, and once they got anywhere else, the rats would get down and infect the people there. They would transmit the virus. So the cures. There's 4 main cures, to talk about it this way. There is ciprofloxacin, levofloxacin, moxifloxacin, and gentamicin. So, ciprofloxacin has only been used 5 times, but it worked every single time. Levofloxacin, helps you, but it's like a protector. It helps you before you get it. And gentamicin works, from the people that used it, but isn't approved by the FDA. There we go. Impacts of using science. The implications of using science are both political and economical factors. Economical because the usual and least expensive antibiotics is worth $200, which for some people can be really expensive. Also because you're forced to do a quarantine, which can make you lose your job and or lose money. It's political because people debate between which work, how efficient they are, and if they damage other things in your body. You have the MLA. So, the disease affecting things. So, this disease has destroyed towns, rural communities, families, and not just because of rats. Farm areas have rats. Rats would come, and the people would be afraid of them because they'd be scared that the rats would transmit the virus towards them. So then they would desert the whole place, and the rats would be like the new owners of the house. Here we have our sources, and thank you for your attention.